as one can expect, obviously the whole COVID-19 situation with the SARS-CoV-2 pandemic has really changed how we do pretty much everything, and healthcare is no exception. I think myeloma patients, we know, just like other patients with cancers, are going to be at a higher risk of getting infections, particularly serious infections that can be life-threatening. So the approach overall has been twofold. One, how can we decrease the risk while maintaining effective therapy for control of the myeloma? So there has been a shift towards trying to see if we can do more oral agents. Can we do less frequent administration of drugs so that the patients don't have to come to the clinic often? Can we ship the oral drugs home so that they can actually do everything from home? Can we minimize the amount of testing? Can we do more telemedicine visits? So a combination of all of these things are happening. Patients, when they absolutely need to come into the clinic, either for imaging studies or for other reasons, then they certainly do come in to get infusions and so forth. If anything can be done without them having come to the clinic, we do that through telephone or video visits. Obviously, clinical trials are going to be important for many of these patients who have exhausted the available options. So we want to try and continue to do the clinical trial options, but still try and do the in-between visits to the extent possible as telemedicine visits. So as much as possible, we want to try and allow patients to maintain the restrictions that have been imposed by local guidelines, but at the same time allow them to get therapies that are effective and can be administered. So it's certainly a challenge, but I think we are all adapting to it. It's not the perfect situation, but certainly the best we can do under the situation.